Following the rising in infections in several countries around the world and the danger the development poses to Africa, the federal government has reviewed Nigeria's COVID-19 response and reintroduced a nationwide 12 a.m. to 4 a.m. curfew as part of efforts to curtail further spread of the virus. The National Incident Manager of the Presidential Steering Committee on COVID-19, MUKTAR, added that nightclubs, gyms and others would remain shut till further notice beginning from Tuesday. He stated that the PSC will continue to maintain restrictions on resumption of work by government workers from level 12 and below, in addition to limiting meetings to virtual platforms as much as possible while maintaining restrictions on physical meetings, official trips and oversight visits.
In line with the increasing risk of a surge in cases, the PSC is therefore maintaining the enforcement of the COVID-19 health protection regulation. This is to mitigate the risk of a spike in new cases while the nationwide vaccine rollout continues. Effective from 0001 hours of Tuesday, 11th May 2021. This phase 4 of the first restriction of movement shall come into effect. We shall maintain restrictions on mass gatherings outside work settings with a maximum number of 50 people in any enclosed space. Approved gatherings must be held with physical distancing measures and other non-pharmaceutical interventions in place.
Well, the National Incident Coordinator of the Presidential Steering Committee on COVID-19 actually joins us now to clarify this new phase of easing of lockdown in Nigeria. Thank you so much for being here, Dr. MUKTAR. Really appreciate you being here. Of course, you know, after the briefing yesterday, there were so many calls and all sorts of reports out there that Nigeria is going back into a lockdown. Well, while you're here, can you clarify that for us? And also this reintroduction, not really of just reinforcing of the curfew, which was already in place. Why are we seeing that happen now, despite the fact that we're seeing the numbers of confirmed cases going down in the country?
So first of all, let me make the clarification. There is no lockdown. We are not in a lockdown state. What we have issued out is actually a reissue of the guideline that is already in existence. This guideline has come into place since March 2021, and we are only reissuing it and just reinstating that those measures will continue to be in place. So there is no curfew, there is no lockdown. What we have is just a 4-hour curfew between 12 midnight and 4 a.m.
Okay, so how do you expect that to have any impact whatsoever on what my colleague Amaka just said in terms of the numbers are dropping, even the numbers of death in some cases? On certain days we don't even hear of any death. How do you expect 4 hours of curfew to really impact anything?
So the 4 hours of curfew is not the only measure that is taking place. And if we just take a step back, you understand that really there are global concerns regarding the rising cases in India, Brazil, Argentina, Pakistan, Peru, and even in Europe, where vaccination has reached some critical level. And we are seeing this increase in cases due to a combination of factors. Number one is that there are new variants that are circulating. Only yesterday, the WHO has declared that the variant that is seen in India is actually now classified as a variant of concern. And apart from that, we've also seen that many countries, with the advent of vaccination, have actually lowered their guard. People are no longer, complying by the public health containment measures. Masks are not used as regularly as they should be. Temperature checks in public places are not quite consistent. And generally, there are gatherings. In India, for example, there were large political gatherings that happened across the various states in the country. And there were also some religious multi-million gatherings, of human beings around, the religious rituals that they do around the Ganges River. And these are the factors that actually, predisposed the population and became the enabling factors for the infection to continue to be transmitted. Now, we looked back here in Nigeria, and we realized that even though our numbers have not been rising, the pandemic seems to have been stabilizing. But looking inwards, we also realize that we are not testing enough. Since the beginning of this pandemic, we've only tested a little less than 2 million people. That is less than 1% of the population. Now, with that level of testing, you may not actually be able to precisely know exactly what is going on in your population. The strains that are prevalent in Nigeria are not actually the strains that have been shown to be either variants of interest or variants of concern. And therefore, introduction of these toxic variants of concern into our society will mean a lot and can actually dominate, the current variants that we have on ground, and will further precipitate, a spike in the infection rate in the country. Okay. And it's out of this genuine concern that we have taken several measures to curtail this.
So it's a precautious move, really, other than, being proactive when we get to that bridge, if we ever get there, which we say, God forbid. So 2 quick questions for you, because you spoke about religious and political gatherings. If you look at the new, updated phase 4 easing of lockdown, you had actually mentioned that churches and other religious entities should not go beyond 50% of their capacity. But for political gatherings, there's no cap on it. You just said, do that according to COVID-19 guidelines. Would not to get a clarification what that really means in that context, and that's one. On the other hand, India, we put some measures in place for travelers who are coming back from India, and even yesterday the chairman of the committee had spoken about some people who arrived the country and are not quarantining according to the protocol on ground. So what punitive measures are you putting in place to get these people to really quarantine, so that way we don't see a transmission of this variant of concern across Nigeria?
So let me start with the later question, which is people who arrived in Nigeria. We have serious measures in place. If you are non-Nigerian in the first place, you will not be allowed entry into Nigeria. If you're from India, if you have been to India or Turkey or to Brazil. If you have a resident permit and you are non-Nigerian, we will automatically take you into a mandatory quarantine for 7 days. If you are a Nigerian returning from any of these countries, or you've been to these countries in the last 14 days, the same thing applies. You will be taken automatically into a mandatory quarantine for 7 days. Now, there are people who we understand have arrived in this country. There are Nigerians, and also we have non-Nigerians who, having arrived, decided to leave the quarantine facility. We immediately set up, our measures in place. We apprehended these people and returned them to quarantine. The non-Nigerians, actually, we are tracking their location, and we are going to take serious measures, which will include expulsion from the country and also revocation of the residence permit that they have in the country. So these are far-reaching serious measures that we are taking. If you are a Nigerian and you evaded quarantine, your passport is going to be suspended.
All right, so clarify on the other one, the religious and political gatherings, no cap on political gatherings.
So INEC has actually, we have had several intensive interactions with INEC since before the beginning of the year, and INEC has rolled out a guideline, a COVID-19 protocol for campaigns, for elections, for party consultations. INEC has actually made it very known. If you recall, we had some elections in Edo and also Ondo states.
And we saw the disregard, especially during the campaigns.
So these measures, there is a difference between putting the guideline in place and also putting the enforcement. So what we are doing with this reissue of the guideline is to ensure that we have brought it to people's consciousness, and also to make sure that there are penalties, that there are enforcement, to these guidelines. There is so much that we can do at the level of the Presidential Steering Committee. We need the cooperation of the security agents, we need the cooperation of the agencies themselves, and we need the cooperation of the state governments to be able to make these enforcements come true. Okay,
Dr. MUKTAR Mohammed, National Incident Manager for Nigeria, thank you very much for helping us understand the issues as they stand.
Absolutely, there's no
There is no lockdown.
No lockdown.
We needed that.
Thank you very much, Amaka. I appreciate it.
Okay.